Have you ever wondered how the world of medicine first stumbled upon the concept of antidepressants? The story is quite fascinating, and like many great scientific discoveries, it all began rather accidentally in the mid-20th century. In the 1950s, the landscape of psychiatry was ripe for revolution. Back then, the primary treatments for depression were psychotherapy and electroconvulsive therapy. But that all changed when a group of scientists stumbled upon a new class of drugs while trying to find a cure for tuberculosis. These were the first generation of antidepressants, known as monoamine oxidase inhibitors, or MAOIs for short. MAOIs worked by blocking the action of a specific enzyme in the brain, monoamine oxidase. This enzyme is responsible for breaking down neurotransmitters like serotonin and norepinephrine. By inhibiting its action, MAOIs increase the levels of these mood-regulating neurotransmitters in the brain, alleviating depressive symptoms. But MAOIs came with a significant array of side effects, including dangerous interactions with certain foods and other drugs. Around the same time, another class of antidepressants was discovered, the tricyclic antidepressants, or TCAs. These drugs worked by blocking the reuptake of serotonin and norepinephrine, allowing these neurotransmitters to stay longer in the brain. This, in turn, amplified their mood-lifting effects. But like the MAOIs, TCAs also had their drawback. They frequently caused dry mouth, blurred vision, constipation, urinary retention, and dangerous heart rhythms. These side effects were not trivial. They posed a significant challenge for patients, and it became clear that a better solution was needed. This led to the development of newer generations of antidepressants, which we'll explore in the next scenes. So the journey of antidepressants began with a serendipitous discovery, but the quest for better treatment options continued. The birth of these drugs marked a significant turning point in the treatment of depression, but it was just the beginning of a long and complex journey. A journey that continues to this day as scientists strive to understand and treat this pervasive and debilitating condition. As science progressed, so did the understanding of depression and the drugs to treat it. This progress is clearly manifested in the evolution of antidepressants. The second and third generation antidepressants, including selective serotonin reuptake inhibitors, or SSRIs, and serotonin and norepinephrine reuptake inhibitors, known as SNRIs, emerged as a beacon of hope for those grappling with the darkness of depression. These new antidepressants marked a significant leap from their predecessors. They were designed to target specific neurotransmitters, the chemical messengers of the brain. By focusing on serotonin and norepinephrine, two key neurotransmitters involved in mood regulation, these drugs aim to restore balance in the brain's chemical landscape. SSRIs such as Prozac, Zoloft, and Paxil work by increasing the levels of serotonin in the brain. They do this by blocking the reabsorption or reuptake of serotonin in the brain, making more serotonin available. This helps brain cells send and receive chemical messages, which in turn boosts mood. SNRIs, on the other hand, like Effexor, Pristiq, and Cymbalta, work on both serotonin and norepinephrine. Like SSRIs, they block the reabsorption of these neurotransmitters into nerve cells, which increases the levels of these substances in the brain. This dual action can help enhance mood and relieve depression symptoms. But what truly sets these second and third generation antidepressants apart is their reduced side effects. Early antidepressants often came with a litany of undesirable effects, from dry mouth and constipation to dizziness and sedation. By more precisely targeting specific neurotransmitters, these newer generations of drugs were able to provide relief from depression with fewer side effects, making them more tolerable for patients. The journey of antidepressants, from their inception to these more targeted treatments, is a testament to the strides we've made in understanding depression. It's a complex disorder with diverse causes and manifestations, and the drugs used to treat it have had to evolve to match this complexity. The evolution of antidepressants mirrors our deepening understanding of the complex nature of depression. The story of antidepressants is far from over, and as our knowledge continues to expand, so too will the tools we have to combat this pervasive condition. Now that we've covered the journey of antidepressants, where do we stand today? In our current era, depression is more prevalent than ever, affecting hundreds of millions of people worldwide. The widespread use of antidepressants in managing depression is a testament to the significant advances in psychiatric medicine. Antidepressants are not one-size-fits-all. They come in a variety of forms, each with its unique way of interacting with the brain chemistry. Selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors, tricyclic antidepressants, and atypical antidepressants are just a few of the classes available today. When prescribing these medications, physicians consider several crucial factors. The patient's symptoms play a significant role in the selection process. For instance, some antidepressants can also help alleviate anxiety symptoms, making them a suitable choice for individuals with coexisting anxiety disorders. But it's not just about the symptoms. The side effect profiles of these drugs are also a vital consideration. Some may cause weight gain, while others might lead to insomnia. As a result, doctors often have to balance the potential benefits of the drug against its possible side effects. Another critical factor is the potential for drug interactions. Many antidepressants can interact with other medications, leading to increased side effects or decreased effectiveness. Therefore, a patient's entire medication regimen must be taken into account when prescribing an antidepressant. In some cases, a trial-and-error approach may be necessary, as it can take several weeks to feel the effects of an antidepressant. And not all individuals respond to the first medication they try. This process can be frustrating for patients, but it's an essential part of finding the most effective treatment. In our modern world, antidepressants have become a crucial tool in the fight against the global burden of depression. They've revolutionized the treatment of this debilitating condition, offering hope and relief to millions. However, their use is not without controversy, a topic we'll delve into in our next segment. So, stay tuned as we continue to unravel the complex world of antidepressants. Subscribe for more because you won't find me later. But like any powerful tool, the use of antidepressants has not been without controversy. This brings us to the crux of the matter, the controversies and criticisms surrounding antidepressants. There's no denying it. Antidepressants have been a game changer for millions around the globe, but their use is not without contention. Overprescription has emerged as a significant issue, with some arguing that these drugs are handed out too freely. They contend that the medical community, faced with time constraints and patient demands, may prescribe antidepressants without a comprehensive mental health evaluation. This, they say, could lead to unnecessary use, fostering a culture of pill for every ill. Then there's the question of dependency. Antidepressants aren't addictive in the traditional sense, but some individuals may experience physical withdrawal symptoms when they stop taking them. This phenomenon, known as antidepressant discontinuation syndrome, can be distressing and lead to a mistaken belief that the individual is addicted. Moreover, critics argue that antidepressants are often seen as a quick fix, overshadowing the importance of psychological therapy. While medication can alleviate symptoms, therapy can equip individuals with coping mechanisms and strategies to manage their depression in the long term. The two, when used in conjunction, can be a potent tool against depression. Yet it's important to remember that these criticisms don't negate the value of antidepressants. They highlight areas for improvement, areas where we can refine our approach to mental health care. Overprescription can be countered with thorough evaluations and consideration of non-pharmacological treatments. Antidepressant discontinuation syndrome can be managed with careful dose reductions and medical supervision. And the role of therapy can be emphasized in treatment plans, ensuring that it's not overshadowed by medication. This brings us full circle. Despite the controversies, when used responsibly, antidepressants can offer a lifeline to those living with depression. They're not a magic bullet, but they're a crucial part of the arsenal, helping many to lead happier, healthier lives. Let's not dismiss them, but let's use them wisely, responsibly, and in conjunction with other forms of treatment. Given the journey so far, what does the future hold for antidepressants? That's the question on everyone's lips as we venture further into the ever-evolving world of mental health treatment. The future of antidepressants is as exciting as it is complex. We're seeing a surge of interest in substances that were once shunned by the scientific community. Among these are ketamine and psilocybin, both of which are currently under rigorous investigation for their potential as novel antidepressants. Ketamine, a drug initially used as an anesthetic, has shown remarkable potential in treating severe depression rapidly. In contrast to traditional antidepressants that often take weeks to show effects, ketamine can provide relief within hours. But it's not just about speed. The effects of ketamine are also long-lasting, providing relief for up to a week after a single dose. Psilocybin, the active compound in magic mushrooms, is another substance gaining significant attention. Preliminary studies have demonstrated that when administered in a controlled setting, psilocybin can lead to substantial improvements in mood and outlook, even in those with treatment-resistant depression. But the future of antidepressants isn't just about new drugs. It's also about tailoring treatment to individuals. Enter the world of personalized medicine, a rapidly growing field that aims to customize treatment based on a person's unique genetic makeup. Genetic testing is becoming increasingly prevalent, helping clinicians predict how a patient might respond to a particular antidepressant. This could mean fewer side effects, faster relief, and a more effective treatment overall. This is just the tip of the iceberg. As our understanding of the brain and mental illness continues to evolve, so too does our approach to treatment. We're moving away from a one-size-fits-all model and towards individualized care, guided by genetics and informed by research into new and unconventional treatments. So what's next? Well, as we venture further into this brave new world of mental health treatment, one thing is clear. As our understanding of the brain and depression grows, so too will our ability to effectively treat it.